Hi, I'm Susie, and I created a YouTube channel with the intention of bringing the small fiber neuropathy community together for support and education. It started in 2017 when I had gastric bypass surgery with complications that resulted in 4 major surgeries over 2 years. Even after the surgeries, I continued to be sick. I was then diagnosed with small intestinal bacterial overgrowth, and after that treatment, I continued to have bizarre symptoms with no answers. Since then, I have seen multiple physicians and specialists with various outcomes. Getting a physician that knows about SFN is next to impossible unless you are a worldwide health organization, and even then, it might take months to get in to see a specialist. After confirmation of my symptoms and tests, my current active diagnosis related to SFN are peripheral sensory and small fiber neuropathy with autonomic symptoms, gastroparesis, Sjogren's, fibromyalgia, chronic UTIs, chronic pain, and POTS. Managing this disease and its symptoms is harder than anything else I've done in my life. And over the years, my symptoms have steadily increased and my quality of life has decreased. My episodes are unpredictable and unbearable and can include, but are not limited to, the following documented symptoms: severe chronic pain 24/7, that includes muscle, tendons, joints, and neuropathy. Dysautonomia, that includes rapid heart rate, an abnormal increase in your resting heart rate, extreme sweating episodes, rapid breathing, shortness of breath. Gastroparesis, or low motility, for which I use daily fleet, Miralax, water, movement, and Reglan, a medication to stimulate your gut. I still may not be able to go to the bathroom for a couple of weeks, and this causes lack of appetite, unintended weight loss, GI and back pain, cramping, nauseousness, vomiting, and incontinence. I also have dry mouth, eyes, vagina, anus, lining of the bladder, gastrointestinal tract, and respiratory tract. It is a result of the exocrine glands being impacted with Sjogren's. Lethargy, chronic weakness and tiredness, lack of sleep. Oversensitivity of extreme hot and cold. Dizzy, unstable, fainting, falling. Basically, I cannot walk or stand for more than 5 minutes, and I use mobility devices for rare trips outside of the house. Brain fog and decreased mental capacity makes tasks, work, speaking, tracking conversations very difficult. This is one of the things that's harder to explain to most people. It takes me 10 times longer to do a task, and I often leave projects incomplete and not finished. I can no longer work due to constant pain and brain fog. I haven't driven in 4 years. I went from FMLA to medical leave to applying for disability. I leave my house for medical appointments and must limit other social activities and errands. I can barely brush my teeth some days, so self-care is spotty. This does not list everything because it is a mystery of what comes next in this medical nightmare. That is how I ended up here, and if you can relate, this is how you ended up finding this channel and or book about small fiber neuropathy. I hope it helps anyone struggling with this. Please leave comments.